On today's Bitesized learning topic, we will be speaking with Dom about strokes. Dom, could you introduce yourself, please?
Hello, my name's Dom. I'm one of the foundation doctors working on Jasmine ward at Tolworth Hospital.
So, Dom, can you tell us what a stroke is?
Sure, so stroke is a life-threatening medical condition which occurs when part of the brain doesn't get enough blood supply. It's really important to act quickly with stroke because the faster you act, the better the person's chances of having a good recovery.
And what would some of the signs or symptoms be of someone who is having a stroke?
So you can remember the signs and symptoms of stroke using the FAST acronym. So the F stands for face, so you might see someone's face start to droop to one side, or their smile might look a little bit different than normal. The A stands for arms, so they might find it a bit difficult to raise one of their arms, or they might get a numbness or a tingling sensation in their arms. S stands for speech, so you might find that somebody's speech sounds slurred or garbled. Sometimes people aren't able to speak at all, and other times it might seem like people are having difficulty understanding what you're saying. And then T stands for time, and that means it's time to call 999 because you need an ambulance as soon as possible.
Typically, what are the causes of a stroke?
So there are two main kinds of stroke. There's ischemic strokes, which are caused by blood clots in the blood vessels in the brain, and there's hemorrhagic strokes, which are caused by bleeds inside the brain. We don't know exactly why some people have strokes and some others don't, but there are certain medical conditions that can make you more likely to have a stroke. These include high blood pressure, high cholesterol, and atrial fibrillation.
I see. How could the ward manage people if they think someone's having a stroke?
So if you suspect a patient is having a stroke, you need to act as soon as possible. And the most important thing to do is to call 999 for an urgent ambulance. You should also inform the duty doctor if you think a patient's having a stroke, but you should definitely call an ambulance first. If the patient deteriorates, you should put out a medical emergency call for assistance as soon as possible.
Thanks for speaking with us today, Dom. I've got a much better understanding about strokes.